All right, peace and greetings to you. This is Omar Abdul Malik, Physician Assistant and Health Education Specialist. I'm here with Thomas Banks Jr., Mr. Thomas Banks Jr. of CMES Training, a physician assistant colleague. So he's going to talk to us about the importance of ACLS certification, Advanced Cardio Life Support.
That's it. Hi, good afternoon. My name is Thomas Banks. As he said, I'm a PA. We are CME's training based out of Florida, and we travel around the country, around the world now, teaching the American Heart Association courses. ACLS, Advanced Cardiac Life Support. We're a stress-free organization. The importance of ACLS is a precursor to BLS, Basic Life Support, and how important it is, and we stress that during the class, and we have a great time doing the class.
Okay. So we covered a lot of information.
A lot of information.
I should say I got off of night shift, 7 p.m. to 7 a.m., and I came to this gentleman's class. It was, I run codes as a hospitalist PA, but there's always things that you can review, like your medications and shocks. What would you say is, for physician assistants, what's some of the most important things that we need to remember with ACLS?
Well, one of the important things that as advanced practitioners that we have to do is we have to make sure the room is calm and organized. Everybody has a job during the code. We found it to be more effective and less mistakes were made when we organized the room and had job specifics for all of our medical staff. That's one of the hardest things to do. And then as the team leader, listening to our colleagues when we're, if suggestions are being made, that we take into account. There's a reason, we have to fix the reason, and once we can do that, we have better survivability of the patients.
And you want to talk to the folks about, I think there's some changes that you mentioned in the
Yes,
2020.
in the 2020 guidelines, and one of the things that the Heart Association is looking at that we talk about is time to compression. In hospital compressions on the medical floors range anywhere from 2 to 3 minutes before chest compressions are started. The goals now are going to be within 30 seconds of cardiac arrest to initiate chest compressions. And then the second goal is called time to defibrillation. And the faster we can defibrillate what we call a shockable dysrhythmia, for instance, if your patient is in pulseless VTAC or chaotic quivering rhythm, VFib, the faster we can shock these patients, the better chances of survival. But one of the key sciences that they're proving was CPR, at least 2 minutes worth of what we call high quality CPR done before that first defibrillation, unless it's witnessed. In a witness arrest, we want to immediately defibrillate these patients.
And you also talked about the importance of non-clinicians, Jane and so-called Jane and Joe average, being at least CPR
Certified. Yes, that it is so important because 70%, according to the American Heart Association, 70% of the patients that suffer cardiac arrest do so outside a clinical facility. So they have found that if bystander CPR, or what we call layperson CPR, and technically the Heart Association calls it family and friends CPR, if we can initiate those chest compressions immediately after cardiac arrest, the chances of survival does increase for that patient.
Okay. And if anyone, let me just introduce your son here, if I could.
How you
How are you?
How you
And
doing?
we covered some very important things. If you can give us, this is a YouTube video, so 3
okay.
take-home points for clinicians about ACLS.
About ACLS, my big things about ACLS are just a team concept. Establishing job security and good BLS care. Even during ACLS, BLS is such an important part of ACLS. Getting those drugs circulated around the body, and that team concept for me.
Okay. And you're an EMT, right?
No, I'm a paramedic.
Paramedic, okay. So, paramedic. So, we all work as a team. There's no more the days of sole clinicians working on a little island by himself or herself. Those days are long over. We've got complete teams that consist of paramedics, nurses, respiratory therapists. Shortly, this room was filled with all sorts of clinicians so everybody's got to function as a team to kind of actualize the most.
Provide the best outcome.
Yeah, that's right, and that's what it's about. It's about saving lives. And briefly, if people, I'm going to put CMS training. I'm going to put the link in the description of this video. So it's www.cmestraining.com, right?
Mhm.
Okay.
And
where
we'll
you
come
guys-
to you.
Okay. All right. Great. Okay, that's it.
Thank you,
guys.
later,
Thank
you
you.
too.
Take care.
All righty. Now, forward that to our Facebook too.